Hello, my name is Sarah Shrimplin-Yakub, and I would like to welcome you to the CDC Partner and Private Sector Call, an update on the COVID-19 response. We would like to thank you for doing all that you are to help protect your employees and communities during this unprecedented time. This call will be recorded and later posted on the CDC COVID website. This call is not intended for media. Media can direct their questions to media@cdc.gov. Before we begin, I'd like to remind call participants that the CDC COVID website has the latest information, guidance, and communications resources. Just since our call last Monday, a couple new updates that, just to name a few, include guidance for cleaning and disinfecting public places, workplaces, businesses, schools, and homes, what workers and employers can do to manage workplace fatigue during COVID-19, updated guidance for reopening buildings after prolonged shutdown, and considerations for public pools, hot tubs, and water playgrounds during COVID-19, a topic that we'll be discussing today. Today's call is part of a series of calls to keep you informed about the COVID-19 response and to hear and respond to your questions. Thank you to those who sent questions in advance. We really appreciate those. We take them, we identify themes, and we try to identify the common questions for discussion today. Speaking of today, our plan today is to hear from one of our leaders within the response, Dr. Grant Baldwin, and then he'll have some time for some Q&A. I am so pleased to be joined here today by Dr. Baldwin, the Community and At-Risk Task Force co-lead for CDC's COVID-19 response. Dr. Baldwin is also the director of the Division of Overdose Prevention at the National Center for Injury Prevention and Control at CDC. He has served at CDC for over 20 years and received his PhD in health behavior and health education at the University of Michigan. He received an MPH in behavioral sciences and health education from Emory University and is currently an affiliated professor at Emory University. I'll now turn it over to Dr. Baldwin to hear some situational updates on the response.
Great, thank you, Sarah, and thank you to all of you for joining today. As Sarah mentioned, my name is Grant Baldwin. I co-lead our Community and At-Risk Task Force, and within the task force and across CDC, we continue to work closely with the White House Coronavirus Task Force and other federal partners to help slow the spread of COVID-19 and to ensure that communities remain safe, healthy, and resilient. There are currently 57 jurisdictions, all 50 states, New York City, DC, the Commonwealth of Northern Mariana Islands, Guam, Puerto Rico, the US Virgin Islands, and the Navajo Nation reporting COVID-19 cases to CDC. As of today, there are unfortunately 1.3 million confirmed and probable cases in the United States that have been reported to CDC, including 21,195 new cases in the last 24 hours. There have been 79,367 deaths in the United States reported to the CDC, including 973 new deaths since the last reported. And we continue to see outbreaks in high-risk settings across the country. High-risk settings include long-term care facilities, prisons and jails, the food industry, and among homeless populations. So as a specific example, there are 7,609 long-term care facilities with confirmed COVID-19 cases from 50 states and territories, and 148,136 cases from 45 states and territories. 605 correctional facilities have had at least one confirmed case among staff and inmates. And there are 17 ongoing outbreaks of COVID-19 among homeless shelters. At least 14 ongoing outbreaks of COVID-19 among meatpacking facilities. We're actively engaged in a whole of government plan to get and keep America open safely and efficiently, providing critical information about COVID-19, including surveillance data about the number of cases throughout the country. CDC is working with key partners to post guidance and decision tools soon to assist state and local partners and other stakeholders in making decisions about reopening, including reopening businesses and adjusting mitigation strategies accordingly. CDC is working with state and local partners and other stakeholders to support decision-making, which will vary locality by locality. And we're working with partners to develop tools and information to support these decisions and help make the return to work as safe and healthy as possible for employers, employees, and the public. We are providing substantial, direct, and tailored technical assistance and robust support to state, territorial, local, and tribal health departments as they consider approaches to mitigate and contain COVID-19 in preparation for reopening the country. As we move into this next phase of the response, CDC is increasing its staff deployments and conducting detailed needs assessments for every state. There are currently 654 CDC staff working in state, tribal, local, and territorial agencies. 13 staff are currently deployed to support the Indian Health Service. All told, a total of 4,474 CDC staff members have participated in the COVID-19 emergency response. And in addition to this ongoing TA, CDC's top priority is getting funds to state, local, territorial, and tribal public health organizations to allow them to surge to meet the challenges of the response. And to date, CDC funding to these local, state, and tribal public health authorities from the CARES Act has totaled $1.627 billion. So mitigation and containment of COVID-19 are the key to get and keep America open. And CDC is committed to leveraging our expertise and partnering with others, including you, on the front lines. With that, let me turn it briefly back over to Sarah.
Great. Thank you, Dr. Baldwin. So as I mentioned earlier, CDC is continuing to share the latest updates on its website. However, I think this would be a good opportunity for you to share with folks what they can consider doing as they try to, fight against COVID-19. Can you share a little bit about what the private sector can do to help keep their workers and communities safe as jurisdictions consider reopening?
Sure, thanks. Yeah, because COVID-19 is highly transmissible and can spread by people who do not know if they have the disease, the risk of transmission within a community can be difficult to determine. And so until there's broad-scale testing that is available and widely implemented, states and communities should assume some level of community transmission is occurring. And states or communities are beginning to ease their stay-at-home orders. It, of course, does not mean that the threat is over. Some level of community mitigation will be needed for some time until there's broad immunity, until broad immunity is achieved or a vaccine becomes available. So communities should adjust mitigation strategies not only to ensure health system and public health system capacity should not be exceeded. So precautions should be taken to protect healthcare professionals and other critical infrastructure workers. So two critical determinants of any community mitigation effort are healthcare and public health system capacity. In this case, healthcare system capacity refers to the ability to treat all new cases and have the means to address any surge in cases. And to meet these needs, communities need to assure healthcare systems have adequate staffing, a surplus of inpatient and ICU beds, and the availability of critical medical equipment and supplies such as PPE. Public health system capacity refers to the ability to detect, test, track, isolate, and quarantine cases if possible to contain further disease transmission. Tracking, isolating, and quarantining cases becomes more viable once community transmission is lower and in instances where there's a more localized outbreak. So right now within the task force, we have 3 focused goals, and they are: first, to further develop guidance and practical tools for adjusting community mitigation activities by sector and setting. Second, to strengthen TA and outreach efforts to states and communities directly, as well as through key partner organizations to optimize community mitigation efforts, including special attention to vulnerable populations and at-risk settings. And finally, to monitor and to evaluate the implementation and outcomes of community mitigation plans, and to actively assess and address challenges identified to support long-term recovery. So over the last few months, we've developed a suite of guidelines, checklists, and FAQs, all available, as Sarah mentioned, on our website. And so we are trying to meet communities where they are as well, and to implement support that is practical, feasible, and acceptable, as well as attentive to the degree of community spread and other characteristics of the population. So ideally, we want to see a steady decline in incident or new cases, and that any rebound that might occur by lifting community mitigation strategies does not exceed, as I mentioned earlier, that public health or healthcare system capacity. We are reimagining our community mitigation foci right now to account for these diversities. And so to this end, we are presuming a sector or setting is reopening in accordance with local law, and hope to offer, as we did on Friday evening, the first of these, some considerations for each sector or setting to refer to. Think of the mitigation strategies as stacked or layered on top of one another. So one strategy alone does not confer protection. However, taken together, they can reduce spread. So let me briefly walk through some considerations for businesses, and they fall into these 4 buckets. First, promoting behaviors that prevent spread. Second, maintaining healthy environments. Third, maintaining healthy operations. And then finally, preparing for if someone gets sick. And so some of these considerations are universal, and some have sector or setting specific centricity. So I'm going to go into detail about, or a little bit of detail, if you will, on what I mean by each of these. So in terms of promoting behaviors that prevent spread, this involves promoting good hygiene, so proper etiquette, promoting etiquette for coughing and sneezing and hand washing, providing tissues, no-touch trash cans, soap and water, and hand sanitizer with at least 60% alcohol, and of course to ensure that there are adequate supplies. Second, to use cloth face coverings, especially when maintaining a social distance is difficult. Actively encouraging sick employees to stay home and developing policies that encourage sick employees to stay at home without fear of reprisals, and to ensure that employees are aware of these policies. Have some conversations with employees about their concerns. So some employees may be at a higher risk for severe illness, such as older adults and those with chronic and underlying medical conditions. And then finally, providing education and training materials in an easy to understand format and in the appropriate language and literacy level for all employees, like fact sheets and posters. So post these signs and provide these materials as widely as possible. That second category, again, is to maintain healthy environments. So this involves things like cleaning and disinfection. So performing routine environmental cleaning, routine cleaning and disinfecting all frequently touched surfaces, such as workstations, countertops, handrails, and doorknobs, and discourage sharing of tools and equipment if feasible. In terms of ventilation, ensuring ventilation systems operate properly and increasing circulation of outdoor air as much as possible. In water systems, taking steps to ensure that all water systems and features, so for example, drinking fountains, are safe to use after a prolonged facility shutdown to minimize the risk of things like Legionnaire's disease and other diseases associated with water. To implement practices to minimize face-to-face contact between employees if social distancing is recommended by your state or local health department, and actively encouraging flexible work arrangements such as telework or staggered shifts. Modifying the environment, so changing workspace layouts to ensure all individuals remain at least 6 feet apart. Installing physical barriers such as sneeze guards and partitions, particularly in areas where it's difficult for an individual to remain at that 6 feet distance, and provide physical guides such as tape on floors or sidewalks and signage on walls to ensure that individuals remain at that 6 feet distance. And then finally, in terms of communal spaces, close communal use spaces such as break rooms if possible, and again, otherwise stagger use and disinfect in between use. And finally, in this category, the last rubric is the sharing of objects. So avoid use or sharing of items that cannot be easily cleaned, sanitized, or disinfected, limiting any sharing of foods, tools, equipment, or supplies, and ensuring that there's adequate supplies to minimize the sharing of high-touch materials to the extent possible. The third bucket, again, is maintaining healthy operations. So this includes things like offering options for vulnerable employees, such as telework or modified job responsibilities that limit exposure risk. Being aware of local or state regulatory agency policies on gathering requirements or recommendations to determine if events can be held. Staggering or rotating shifts to limit the number of employees in the workplace at the same time. Avoid group events and gatherings or meetings where social distancing of at least 6 feet between people is difficult to maintain, and limit any non-essential visitors, volunteers, and activities involving external groups or organizations. Again, another point on telework, so encouraging telework for as many employees as possible and replacing in-person meetings with video or teleconference whenever possible, such as we're doing now. In terms of travel and transit, considering options for non-essential travel in accordance with state and local regulations and guidance. Designate a staff person to be responsible for responding to COVID-19 concerns. And all employees should know who to contact know that that's the person to contact. In terms of communication systems, putting systems in place for staff and customers to self-report symptoms and sickness, to notify local health authorities of COVID-19 cases while also maintaining confidentiality in accordance with the Americans with Disability Act. Notifying staff and customers as feasible of COVID-19 exposures, and notifying staff and customers and the public of any closures. In terms of leave policies, it includes things like implementing flexible leave policies and practices, and developing policies for return to work after a COVID-19 illness that's in accordance with CDC's criteria to discontinue home isolation. Just a few more, and I'll wrap up here. So monitor absenteeism of employees and create a roster of trained backup staff, train all staff on safety protocols, and again, conducting virtually or ensuring social distancing during training. Of course, the importance of being able to recognize signs and symptoms, such as conducting daily health checks, such as temperature screening and or symptom checking of staff safely and respectively, and in accordance with any applicable privacy laws and regulations. And of course, businesses may use examples of screening methods that are available on CDC's general business FAQs as a guide to that. And then finally, and I'll wrap up here, in terms of preparing for someone when someone gets sick, you need to isolate and transport those who are sick. So employees or customers with symptoms such as fever, cough, or shortness of breath should immediately be separated and sent home, and individuals who are sick may follow CDC guidance for caring for oneself and others who are sick. Notifying the appropriate health officials and close contacts. So notifying local health officials, staff, and families immediately of any possible case of COVID-19, again, while maintaining that confidentiality in accordance with ADA, and informing those who've had close contact with a person diagnosed with COVID-19 to stay home and self-monitor for symptoms and follow CDC guidance if symptoms develop. And finally, I'll close with, again, a reminder of cleaning and disinfection. So closing off areas used by a sick person and not using them until that cleaning and disinfection has occurred, and waiting 24 hours before cleaning and disinfecting. So with that, let me close there. And Sarah, I suspect there may be a number of questions either in the chat or the ones that you've put together by theme that you received in advance of the webinar. So happy to take those.
Excellent. Great. Thank you, Dr. Baldwin. So yeah, let's dive into some questions. So the first one, I know we talk a lot about protecting people from getting sick from COVID-19, but one thing that we may not speak as often of is just the mental health repercussions of what's happening. Folks that are struggling with having lost a job, financial struggles, loved ones that have become sick. I'm just curious if you could tell us what you might suggest to businesses, what businesses could do to help support their staff within the workplace that are dealing with mental health issues.
Yeah, great. You brought up, frankly, a really important point and a really important topic. Obviously, we recognize that the pandemic has really touched all aspects of our society, and there's been a ripple effect across a wide variety of domains, including our social and mental well-being. So fear and anxiety about this new disease and other strong emotions can be overwhelming, and workplace stress, of course, can lead to burnout, especially now. And the uncertainty of this virus, frankly, is very, very stressful. So many questions that we just don't have answers to as of yet. So how you cope with these emotions and stress can affect your well-being as well. So the well-being of people you care about, your workplace, and your community. Fortunately, last week we published some guidance applicable to all employees about how to cope with job stress and build resilience during the COVID-19 pandemic. So it's critical that everyone recognize what stress looks like, what steps to take to build this resilience and manage job stress, and to know where to go to help. We also published guidance specific for emergency responders, healthcare workers, and others providing essential services who may be especially stressed thin, working longer hours than usual and leaving less time for sleep and recharging that is so critical for all of us. So employers also have an important role to play in supporting their workforce. So here are some examples of some supportive policies and practices, such as I mentioned a few minutes ago, ensuring flexible sick leave, connecting employees to employee assistance programs, and other community resources as needed. So employees may need additional social, behavioral, and other services to cope with the death of a loved one from COVID-19. Making sure employees know where to go if they need help or more information. And again, ensuring that sick leave policies are flexible and consistent with public health guidance, and that employees are aware and understand those policies, and that employers that do not currently offer sick leave to someone or all employees may want to draft non-punitive emergency sick leave policies. You know, the stress and strain of COVID-19, I think, has hit all of us. It hit all of us differentially. Before I rolled onto the response to serve in the role I did, in my usual day job responsibilities, I think my team and I came up with a number of different creative ways that we worked to deal with the increased levels of stress and strain. And that included having walking meetings where we were able to socially distance and actually just walk around our own neighborhoods. And so instead of sitting in front of Zoom all day, we would walk around and simply talk over the phone. And I was frankly really buoyed by the creativity showed by my staff in coming up with ways that I'm sure many of you and the places you work have been similarly creative to deal with the stress and strain that I think is overwhelming all of us to a certain degree.
Excellent, thank you. You know, one question that seems to come up every week, but I think it's worth just reiterating, is what do you see as being symptoms that employers should really be keeping an eye out for and should be telling their employees not to come into work if they're displaying?
Yeah, so there's a short list of symptoms that are pretty common. I'm going to mention them to you now. They include, I think you've probably heard many of these: cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, a sore throat, a new loss of taste or smell. But of course, that list isn't inclusive. So people with COVID-19 have had a much wider range of symptoms reported, you know, ranging from very mild symptoms to very severe illness. And symptoms may appear anywhere between, and that's what's so insidious about this virus, symptoms may appear 2 to 14 days after exposure to the virus. So other less common symptoms have been reported, including GI symptoms like nausea, vomiting, and diarrhea. And employees who have symptoms when they arrive at work or become sick during the day should immediately be separated from other employees, customers, and visitors and sent immediately home. And employees who develop symptoms outside of work, of course, should notify their supervisor immediately and stay home.
Right, and for those who have tested positive, at what point can they return to work? What would your recommendation be?
So yeah, here sick employees should really follow CDC recommended steps, and this includes not returning to work until they've met the criteria to discontinue home isolation and have consulted with a healthcare provider in state or local health department. So employers should not require sick employees to provide a negative COVID-19 test result, or healthcare providers note prior to return to work. Employees with COVID-19 who have stayed home can stop home isolation and return to work when they've met one of the following sets of criteria. And they're important, so I'm just going to go through them in detail. I apologize, I'm a little bit worried, but I want to mention them. So option 1, if in consultation with a healthcare provider and local public health authorities, knowledge of all about local available testing resources, it is determined that an employee will not have a test to determine if they are still contagious, the employee can leave home and return to work after these 3 conditions have been met. First, the employee has had no fever for at least 72 hours. That is 3 full days of no fever. without the use of medicine that reduces fever. Second, respiratory symptoms have improved. So, for example, cough or shortness of breath have improved, and at least 10 days have passed since their symptoms have appeared. And then the second option, again, the same set of 3 conditions that have to be met. So if in consultation with a healthcare provider and local public health authorities knowledgeable about the locally available testing resources, it is determined that the employee will be tested to determine if the employee is still contagious. The employee can leave home after these 3 conditions have been met. The employee is no longer has a fever, again, without any use of medicine that reduces the fever. Respiratory symptoms have improved. So, for example, cough or shortness of breath have improved. And finally, they have received 2 negative tests in a row, at least 24 hours apart. And their doctor should follow CDC guidelines. So CDC and our partners were investigating to determine if you can get sick with COVID-19 more than once. And at this time, we are not sure if you can become reinfected. And so until we know more, employees should continue to take recommended steps to protect themselves and others. And again, I'd refer you to the CDC webpage.
Excellent, thank you. There's been a couple comments already made about the idea of folks needing to quarantine. What should someone consider if they're really not quite sure when it was that they became exposed? When should they consider that 14-day quarantine to begin and end?
Yeah, so actually this is a thorny area. So for data for us are limited to define a close contact, but factors to consider when defining a close contact include things like proximity, the duration of exposure. Obviously, longer exposure time likely increases your exposure risk. Whether the individual had symptoms at the time of exposure, so were they coughing, that likely increases your risk, and whether the individual was wearing a face mask, so which can effectively block respiratory secretions from contaminating others. Actually, when you're wearing a cloth face covering, it's really providing source control. But unfortunately, data are insufficient to precisely define the duration of time that constitutes a prolonged exposure. Recommendations vary on the length of time of exposure from 10 minutes or to more than 30 minutes or more. So in healthcare settings, it's reasonable to define a prolonged exposure as any exposure greater than a few minutes because the contact is someone who is ill. But brief interactions are less likely to result in transmission. However, symptoms and the type of interaction, again, did that person cough directly into your face? Those remain important factors that you need to wrestle with. An employee caring for a sick family member at home should also follow CDC's advice for caregivers. We can follow up with a link afterwards and recommended infection control precautions to ensure they protect themselves and others. So again, an individual providing care in their home for someone who's symptomatic with COVID-19 without recommended precautions may not know exactly when their last exposure occurs. And in this case, they should follow that home isolation period. So stay home until 14 days after the person being cared for meets the criteria for discontinuing home isolation. So again, that 14-day quarantine period.
Excellent, thank you. Do you have any recommendation for folks who are having issues getting their hands on soap and hand sanitizer?
Yeah, no pun intended with that, right, Sarah? It's interesting. I would just call your usual supply chains to see if they can provide some help here. Your state and local health departments also, we're trying to work closely with folks through the FEMA National Response Coordinating Center to make sure the resources are in place so that the state and local health department may also be a good source.
Excellent, thank you. Can we use, let me rephrase this. Can UV lights be used to sterilize a building? What products should we consider using for cleaning or disinfecting?
Yeah, so you mentioned it in your opening, but I'll just repeat it here. So last week, CDC and EPA released some comprehensive reopening guidance for cleaning and disinfecting public spaces, workplaces, businesses, schools, and homes. Actually, it was released on the 29th, and of all the web pages right now on our community mitigation site, it's getting the most hits. So normal routine cleaning with soap and water will decrease how much the virus is on surfaces and objects, which obviously reduces the risk of exposure. But disinfection using one of those EPA-approved disinfectants against COVID-19, again, go to the website to find that list, can also help reduce the risk. So frequent disinfection of surfaces and objects touched by multiple people is important. I mentioned that point earlier. Let me just reemphasize it here. And as I said, EPA has compiled a list of disinfectant products that can be used against COVID-19, including some ready-to-use sprays, concentrates, and wipes. So when EPA-approved disinfectants are not available, there are some alternatives. So alternative disinfectants can be used. So for example, 1/3 cup of bleach added to a gallon of water, or about a 70% alcohol solution. But of course, don't mix bleach with other cleaning or disinfecting products. So it's really there's some real comprehensive approaches. But the efficacy of alternative disinfectant methods such as high-intensity UV radiation, ultrasonic waves, LED blue light against COVID-19, all of that is unknown at this point, to answer your question. EPA does not routinely review the safety or efficacy of pesticide devices such as UV lights, LED lights, and ultrasonic devices. So at this point, EPA cannot confirm whether or under what circumstances such products might be effective against stopping the spread of COVID-19.
Thank you. We received a number of questions from folks thinking about going back to work, and specifically computers, docking systems, these areas that require touch. Just curious how you would recommend these items be handled within the workplace.
Yeah, happy to tackle that. If it's okay with you, Sarah, I'm seeing a question in the chat around cloth face covering, so maybe I'll touch on that first, and then I'll go to your question.
Excellent, thank you.
And so in terms of cloth face coverings, we're recommending that all people wear a cloth face covering to cover their mouth and nose in community settings, especially in situations, as I mentioned in my opening remarks, when you're near people. These can include places like grocery stores, pharmacies, and restaurants. I should mention, as a word of caution, cloth face coverings should not be placed on young children younger than 2 years of age, anybody who has trouble breathing, of course, if they're unconscious or incapacitated or unable to remove the cover without some assistance. So, the other thing I'd mention, it's interesting, and that face coverings are really not a substitute for social distancing. They're especially important to wear in public, in areas where there's widespread COVID-19 illness. So again, a cloth face covering is to protect people around you if you are infected but do not have symptoms. Again, it's a source of source control. So you were asking about, sort of offices and shared workspaces and computers and docking stations that many people use. So where possible, we discourage workers from sharing phones, desks, offices, or other work tools and equipment. So frequently touch surfaces and objects like keyboards and light switches and doorknobs will need to be regularly cleaned and disinfected to further reduce the risk of germs on those surfaces. And if there are multiple people who must use a workspace, again, consider minimizing face-to-face contact between the employee, assigning work tasks that allow them to maintain at that distance, that magic distance of 6 feet or more, if possible. And other strategies that can promote the social distancing include things, and I mentioned a few of these earlier, allowing flexible work sites, allowing for flexible work hours, so staggering shifts, increasing physical space between employees at the work site, increasing physical space between employees and customers, such as using drive-throughs and partitions. We're seeing that more and more often, certainly here in Atlanta where I live. Implementing flexible meeting and travel options, such as postponing non-essential meetings or events. I think that's fairly common practice now. Downsizing operations if unfortunately that's necessary. And again, delivering services remotely, phone, video, web, or delivering curbside or pickup delivery. So those are some specific examples of how you may attend to that issue of sort of shared equipment.
Excellent, thank you. Is it safe for, say, a cafe within a building to reopen?
Yeah, so it's a good question actually. So we've been working with the FDA on some resources for food establishments, and this weekend we were really pleased to see that the FDA released a checklist and an infographic that we consulted on, designed to assist retail food establishments that might have been closed or partially closed during the COVID-19 pandemic in preparing to reopen. So there are a couple of documents, again, designed to help businesses prepare to serve food or sell to the public directly, such as restaurants, bakeries, bars, carryouts, etc. Again, we can follow up or afterwards with a list of resource materials, or feel free to reach out to CDC Info. We can certainly point you in the right direction.
Excellent. We've received a couple questions in the chat box, as well as, in preparation for today's conversation about temperature screening. Should employers be screening the temperature of their staff, and what would be considered a high temperature?
Yeah, it's a good question. Critically important to have an answer to. So, in terms of, it is important to conduct some daily health checks. I'm teleworking today, but I was at the CDC campus earlier and experienced what I'm about to say to you, which is a temperature screening and or a symptom checking of staff safely and respectively and in accordance with applicable privacy laws and regulations is certainly one strategy businesses can use to maintain healthy operations. But we have other examples of screening methods in some of CDC's general business FAQs, so I encourage you to take a look there. In terms of specific temperature, again, temperature screening is an optional strategy that employees may use, but CDC considers a person to have a fever when he or she has a measured temperature of at least 100.4 degrees Fahrenheit or 38 degrees Celsius. So when implementing this temperature screening, it's important, obviously, to protect the employee conducting the screening. So again, most protective methods incorporate some degree of social distancing or physical barriers to minimize or eliminate the risk of exposure to the screener during that process. And of course, it's critically important to continue to rely on social distancing. So in some instances, it's possible to ask employees to take their own temperature either before coming to the workplace or upon arrival. And again, staying away at least 6 feet away from other employees in doing that. Yeah, again, I'll probably stop there. I think that sort of covers the sort of core question about temperature and what we want to do.
Excellent. If someone gets sick, I know there's a lot of talk about cleaning the space that the individual has worked within, but how do we define space? And also just thinking about even the restrooms. I know that's something that has come up in the chat box a few times, public restrooms.
Yeah, so it's important to close off areas used by a person who is sick and do not use it. Do not use those areas until after cleaning and disinfection has occurred. Companies, I should emphasize this because it's critical, companies do not necessarily need to close operations if they can close off the affected areas. What this means is ideally waiting 24 hours before you clean or disinfect. So if 24 hours is not feasible, wait as long as possible. Open outside doors and windows to increase the air circulation. And then cleaning and disinfecting all areas used by the person who is sick, such as offices, bathrooms, common areas, shared electrical equipment, like some of the things we were talking about earlier, tablets, touchscreens, keypads, etc. And then vacuuming the space if needed. We just came out actually with some vacuuming guidance. So use vacuum equipment equipped with a high efficiency particulate air HEPA filter if available, but do not vacuum a room or space that has people in it. Wait until that room or space is empty to do that vacuum, such as nighttime and other ones. But I should also say, once that area has been appropriately disinfected, it can be open for use. So workers without any close contact with the person who is sick can return to work immediately after disinfection. So if it's been more than 7 days since that person who is sick visited or used the facility, additional cleaning and disinfection is not necessary. But obviously, it's important, as I mentioned in some of my overview remarks, to continue routine cleaning and disinfection. So this includes everyday practices that businesses and communities are normally used to maintain a healthy environment. And I want to, at this point, Sarah, I made this point, I think, on a light touch basis in some of my opening remarks, but I want to emphasize it here too. When we think of community mitigation, we're thinking about the layers of protection that can be stacked on top of one another. It's not just simply one thing. It's not just social distancing. It's not just cloth face coverings. It's not just cleaning and disinfection. You layer all of those things on top of one another, and that's where you maximize or minimize your risk of exposure.
Excellent, thank you. You know, we've spoken a lot about the symptoms that employers should look for in the workplace and employees should consider, but what about the asymptomatic individuals? How concerned should employers be about asymptomatic transmission?
It's a great question. I think the asymptomatic question is one that we're getting often at this point. So we're still learning, frankly, about asymptomatic transmission and what symptoms are more or less contagious. But someone who is asymptomatic, obviously, as we know, can spread the disease or spread the virus. So the potential for asymptomatic transmission is one of the reasons that we are recommending that the wearing of a cloth face covering. Again, cloth face coverings may prevent people who don't know they have the virus from transmitting it to others. So it's a source of protection. So every time we cough, sneeze, or breathe, we are sharing our germs with others. And again, that cloth face covering helps keep those germs and the potential COVID-19 virus from spreading to others. So frankly, it's really critical. I was talking to my wife the other day, and I said, sweetheart, you know, one of the things I'm hoping for is that in the weeks and months ahead, until we have a vaccine or a more definitive therapeutic, that the wearing of cloth face coverings really becomes a social norm. If you harken back to the days in the early 80s when virtually no one wore a seatbelt, and now upwards of 90-something% of Americans are wearing seatbelts, given the urgency of the task, part of what I have urgency on in the seat I occupy right now in the response is, how do we create that social norm where the wearing of cloth face coverings just becomes part of our everyday dress or wears?
Oh, that's a great point. When thinking about travel, at what point do you think it'll be safe for travel again? Should we consider quarantining after returning from a trip?
Yeah, it's a good question. I think all of us who travel frequently and enjoy being on the road and seeing others and visiting both family members, friends, and when we're on the job, I think are eager to get back to travel. But I think it's important to carefully consider when travel is necessary at this point. And if, as I mentioned earlier, using video conferencing or teleconferencing when available for possible work-related meetings and gatherings. At this point, employers should consider canceling or adjusting or postponing large work-related meetings or gatherings that can only occur in person. So we have some guidance on the CDC website for those mass gatherings or large events. But when video conferencing or teleconferencing is not possible, holding meetings in opening and well-ventilated spaces, and again, that magic 6 foot mark, I want to harken on again, spacing chairs at least 6 feet apart, and of course, encouraging staff and attendees who are sick to stay home. So we're working with our state and local partners and other stakeholders to support decision-making regarding reopening, as decisions will vary from locality to locality. But if you must travel, again, follow any state and local travel restrictions that are currently in place. At present, CDC is recommending you stay at home as much as possible, especially if your trip is not essential, and practice social distancing, especially if you are at a higher risk of illness. So don't travel if you're sick, or travel with somebody who is sick. I think employers will want to work with staff individually, to be honest with you. So to make shared decisions that consider an individual's risk factors and reflect the spread of the virus in the community at that point in time. But if you must travel, of course, there's several things that you should consider doing before you go to protect yourself and others during the trip. Again, a lot of these are the same kinds of social norms we've talked about throughout this call. So cleaning your hands often, avoiding touching your eyes, nose and mouth, avoiding close contact with others. Again, wearing that cloth face covering in public, covering coughs and sneezes, picking up food at drive-thrus, curbside restaurants, etc. And if you must travel, considering the following risks that you might face depending on what travel you're doing. So in air travel, obviously because of how air circulates and is filtered on airplanes, most viruses and germs do not spread easily on flights. So I want to debunk that myth. But however, there may be a risk of getting COVID-19 on crowded flights if there are other travelers on board with COVID-19. And I know many of the airlines are are changing requirements on wearing of masks and or not filling those planes to full capacity to support those social distancing requirements. In terms of buses and trains, again, sitting that magic 6 feet apart from others can help reduce the risk. In terms of car travel, the stops you need to make along the way to refill, again, trying to minimize your close contact with others who potentially could be infected. So there's just a range of things that you can do. Again, it's a precautionary principle that I think we are wanting folks to follow.
Excellent. Well, this concludes our time today. Dr. Baldwin, do you have any additional thoughts or closing remarks?
No, it's just great to be with all of you. Thank you for your commitment. Thank you for your vigilance. Thank you for your interest. Like many people, I believe we can all get through this together with adopting some of those mitigation strategies that we know work. I think we're just, I appreciate everyone's interest and commitment to the work. So thank you very much.
Excellent. Thank you, everyone, for joining. A recording for today's call will be posted on the CDC's COVID-19 page. One thing I'd like to recommend, if interested in getting invitation for the future week's calls next Monday and those that follow, is for you to subscribe to our CDC's private sector updates. And so what I'm going to do is hit send in the chat box and share with you a link to subscribe to that page. Again, it'll just basically take you to a listserv to just ensure that you receive updates in the future. So again, thank you so much for your time, and we hope you'll join us next week. Have a good afternoon.